first want to introduce myself. I'm Amber Talley. I'm starting a fitness brand. It's called Fancy Athletics. It's for mind, body, and style. But with it being Mental Health Awareness Month, I thought it would be a great pleasure to have my favorite girl, Eletta Cameron, with Cameron Counseling and Consulting Services. Hi, Eletta.
Hi, Amber. How are you?
I'm amazing. How are you?
I'm good.
That's good.
Thanks for having me.
You're welcome. You want to introduce yourself?
Yeah, my name is Eletta Cameron, and I am the owner of Cameron's Counseling and Consulting Services, LLC. I am a licensed clinical social worker, and I've been in private practice for 10 years now, but I've been a social worker for going on 29 years.
Wow.
I know, long time.
Very long time.
I'm still loving it, though.
This is what you're meant to do.
I believe that.
Good.
I believe this is my purpose.
Well, thank you for coming today. I just have a few questions for you.
Sure.
A lot of people don't like to be told they have to go to therapy, don't want to go to therapy, and I just want to answer some questions that people may have
Absolutely.
in the world. So
Absolutely.
my first question is, how do you define mental health?
So I love that you asked that question, because people always wonder, like, well, what is mental health? They think it's this thing that just happens. Everybody has mental health, right?
Mm-hmm.
Mental health is how we cope. It's how we behave. It's how we manage. So it's what you think creates a feeling, and it creates a behavior. And from that, it's what we do every day. So every one of us has mental health, from little people all the way up until you die. Mental health exists. So that's what mental health actually is.
Okay,
Yeah.
good. Thank you.
Yeah.
That's actually a good definition.
Yeah.
Because a lot of people think mental health is just bad mental health.
Exactly. And I love that you make that point, because when you hear it, it is often associated with something that is happening when people are having a psychotic break, or like a difficult moment. And it's, they're having mental health issues. But we all can have mental health issues, and it's on a continuum. So it can be mild, or it can be extreme. But there is a difference between mental health and mental illness, and we'll probably talk about that a little bit later.
Okay. Thank you.
You're welcome.
Do you believe stigma prevents people from seeking necessary treatment?
I believe labels keep people from seeking necessary treatment. And so when we talk about stigma, I'm starting to see that there's definitely a lot more conversation about mental health, particularly like in social media, particularly around with young people in sports and things of that nature. But I do think that labels sometimes inhibit people from seeking a counselor or a therapist, because in their minds they think, well, if I'm giving this particular diagnosis, then that's going to be with me for the rest of my life, and everybody or anybody is going to be able to access it. And so I think it's important for people to understand that when you do see a therapist or you see a psychiatrist, and if you're using insurance, then yes, there's going to be a diagnosis that is given in order for providers to be paid. However, we treat individuals, right? We don't treat the label. So it's just like if someone has diabetes. So individuals can say you have diabetes or you're diabetic, right? Well, a person can have depression. Doesn't mean they're always going to be depressed. So just like you treat diabetes with medication or injections, you also treat depression with therapy and sometimes with medication. So again, we're treating the person, though, because the reason for depression can be very vast, and that's what therapists and or psychiatrists are looking at. Psychiatrists prescribe the medicine. Therapists usually talk with people through the process.
Okay. And when you say, I heard you say label, that is really what people think. If I go to therapy, everyone's going to know I'm in therapy. Everyone's going to know I'm broken. And it's just like a pride thing, I feel like, when it comes to therapy, until you're at the end ready to take your life.
Absolutely. And I think not only is it pride, but it's also just not knowing. It's just not understanding what therapy is about. A lot of times when people call me and they say, this is my first time, and I ask, what questions do you have? And they'll say, well, what should I expect? And I say, a conversation just like this, right? Because oftentimes they are looking at therapy based on what they've seen on TV. And usually what they see is kind of the worst case scenarios of things on television. So they see somebody laying on a couch. They may see somebody who is, a hypnotist. And there are people who are trained in hypnosis, of course, but that's not always what therapy is. Most times that's not what therapy is. Hypnosis is a specialized thing. And so every therapist is not a person who does hypnosis.
Okay.
So more than anything, it's really about just coming in, talking about what brings you to this place of wanting to talk with someone. And usually a therapist has a guided set of questions and things that help a person get to a place of understanding what's going on with them, but it helps the therapist better also understand how they got to where they are.
Okay.
So I always start out asking people, once I understand what they're presenting, what we call presenting problem, like what brought you there.
Okay.
I also ask, what do you want to get out of this? Because the goal isn't for me. The goal is for me is to make sure that anyone who accesses me gets to their optimal level of mental health and wellness, period. But my goal can't be their goal, right? So I always ask, what do you want to get out of this experience? How would you be different? How would you think differently? How would you feel differently? How would you behave differently? And that helps me to better understand how to assist them in getting there.
Okay, that's good.
Yeah.
Do you find those questions challenge them and they're taken aback? Because you come to therapy and you're like, okay, I'm here. They told me I need to be here, so I'm here. But when you ask those open-ended questions, it's like, oh, wow, I didn't think that far.
Yeah, sometimes. And the reason that you ask is because therapy, and I think care all the way around really needs to be patient-centered, right, or client-centered. And so when you start to ask those questions, it really does make them think as to, why am I here? Aside from people telling me I need to be here, most times individuals aren't going to come if they don't believe that there's an inkling of need to come there. When people are mandated, though, the same thing. When people say, somebody told me that I need to come, or I'm mandated to be here, I ask them, well, what do you believe, right? And so it's not taking the word of the person who sent them, but it's really looking at, okay, but you still showed up. Because people can refuse, even if they're mandated, they can refuse. Some people are willing to take that loss. But when people show up and they get in the chair, then it's like, okay, so what brought you here? Why are you really here? People start talking. I think you have to make people feel comfortable and feel like it's an experience like anything else. There's no what I call boogie booism. There's nothing scary. I think the biggest thing is people think am I going to tell something that I don't want anybody to know? Nope. Because I'm not going to ask anything that you don't want anybody to know. Everyone has their own ability to say what it is that they want to say and talk about what they want to talk about. I just tell people, be honest, coming into therapy, more not just with me, but really with themselves, because you get out of therapy what you put into therapy.
That was good. That was good. And I agree with that because we tend to lie to ourselves a lot, putting on a facade for others. And it's like you're never going to unlock what you need to unlock.
Exactly.
That way.
Exactly.
Thank you. Thank you.
Absolutely.
What kind of impact can stigma have on someone's mental health journey?
Well, I think that stigmatizing the concept or the idea of getting help can definitely keep people from seeking out mental health services, right? But again, at the same time, once people really begin to understand that everyone has mental health, that really should take the stigma away. Now, how people care for their mental health, what is defined as mental health hygiene, right? That's a different thing. So how we take care of ourselves, some people use drugs to deal with challenges that they may have. Some people use food, some people use sex, some people use gambling, and there are a whole gamut of other things that people use in order to cope. What you find is that coping is not conducive to good living after a while. So if they're gambling, sometimes they're going to end up broke. Sometimes they're going to end up in financial crisis, right? Sometimes that's what brings them into counseling. Sometimes it doesn't bring them into counseling. So the stigma really more so is based on, again, the idea of what's going to happen to me once I get into counseling, or something is wrong with me. And I always say, something is right when you know yourself well enough to show up for counseling. Even if you say, I have no idea how this is going to go. I just know I need to talk to somebody. That's a starting point. So,
which is, I'm laughing because you said the mental health care. Like, I'm a gym girl, but I've learned over the years that it was all mental. I don't care what's going on in my life. I'm going to the gym, and it was excessive to where I was burnt out, hurting myself, all because that was the only place I was able to mentally control any emotions I was going through.
And again, too much of anything becomes a bad thing, right?
True.
And I always tell people, like, if your mental isn't where it needs to be, if you're not operating at an optimal level, it's sooner or later the rest of you is going to fall apart in some capacity. And I've seen, over the years, I've seen people who are doctors, lawyers, PhD level, and people would always say, like, well, why aren't they taking their medicine, so to speak, right? I remember this vividly. Why aren't they taking their medicine? They have a PhD. I remember saying, them taking their medicine has nothing to do with their intellect, right? It has everything to do with how they're thinking about their condition, how they feel about their condition, and that's how they're going to behave. So we really have to be able to zone in on what people are thinking, because how you think changes everything that you do. Everything that you do. So.
Yes. Okay.
Yeah.
Well, you're good at this.
Well, thank you, ma'am.
You're welcome. What do you think needs to happen socially or culturally for people to see therapy as a strength and not a weakness?
So socially, I think it's happening, right? I think that because of TikTok and Instagram and all of the platforms that I definitely cannot name that young people are on, you see a lot more conversation about mental health. Some of it is accurate. Some of it is, people who've been through something and, they're sharing what they know. And I think that that's good. I think that that's good. At the same time, I think that when individuals definitely believe that they need to see a professional, they shouldn't seek out a professional on TikTok or Instagram. They should, get in contact with, if they carry insurance, get in contact with their insurance carrier, get in contact with somebody that they may know who's gone to therapy, because a lot of times as a therapist, I know a lot of my clients come through word of mouth. But I think socially that is happening. And again, because there's so much more access socially, there are a lot more people talking about it. I think that the sports world really weighs heavy on how people view mental health and wellness. And you see a lot of athletes talking about that. So I think that that's important. So culturally, I think it's just a matter, again, of conversation. We know that there are certain cultures who are definitely more reserved in regards to seeking out mental health services. And a lot of times it's really just because of exposure. I know growing up, I never heard of the word mental health. I heard things of people say like, she's having a spell, right? And I'm like, a spell? Like, what is a spell? And that's how we looked at it. But no one ever said, hey, are you taking care of your mental health and wellness? But when I look back now, I know that there were people who were depressed, now that I know what it is. But before I didn't know what it was. So you just take for granted what people tell you. Oh, she's having a spell. Okay. Right. So I think being a woman of color, and being able to go back into my community, into my family, into other people's families, and talk about what it is that I do, not as a means of like, you need mental health services, but as a means that mental health services shouldn't be something that you shy away from. It should be something that you embrace because you're caring for yourself, and you have a better life when you're thinking better because you feel better, So, but culturally, I just think it's more about conversation. I think, and it's not only cultures of African-American cultures. There are a lot of cultures who have not had mental health necessarily introduced to them, and they have certain beliefs around how you take care of yourself. So it's like, your mother, God, and the pastor, in no particular order except for God first, maybe.
Yes.
But a lot of people believe that. They believe, like, you know, you use your religion or your spiritual beliefs and that is your mental health. And in a lot of ways, in part, that is part of mental health. It's just not exclusive to mental health.
Yes. And I agree. I think mental health is, you have to have a lot of things you can fall back on. You just can't
Absolutely.
say, okay, I go to therapy, I'm good. You can't just say, I journal, I'm good, or
Right.
I talk to God, I'm good. There is a lot of things. It's like you got to have like a routine. How you wake
Absolutely.
up, brush your teeth, do all those things. You have to be like, okay, I need to meditate, I need to journal. These are things that keeps my mind from doing destructive work.
Absolutely. And it's like you go to the gym. And so, you know, you have a routine for going to the gym. So if you have someone who wants to lose weight, they can't say, well, I'm going to go to the gym, but I'm going to eat the same
Yeah.
thing that I've been eating, right? Because you're going to look at them like, okay, but if they want to get shredded, you know, but they're still eating cake and, you know, eating late at night and drinking soda, things of that nature, they may be putting in the work at the gym, but at home, they're not doing what's going to be conducive to maintaining that work at the gym. So then frustration builds in, right? So it's the same thing with mental health. If you come into the office, you're going to learn tools and things. However, if you're not using those tools outside of the office, then what begins to happen is you keep going to the office trying to get reinforced. And I always tell people, therapy happens outside of the four walls. We are processing about what you've learned and what you're applying, but you have to go out and figure out, okay, we talked about this before, let me try this, and then come back and say, oh, just like going to the gym, you don't just work out at the gym. You know, you get a good workout in the gym, but you also want to work out at home. You also want to be doing things at home to continue, like, keeping your mass and stuff together. So I just think that it's, people have to understand, you're absolutely right, that there is a routine. And it is about how you wake up in the morning. What are you telling yourself in the morning? What are you telling yourself when you go to bed, you know, at night? How are you looking forward to the day? And, you know, we can have one scenario, but two different perspectives. And that can change how people move through their day. They can get up and it's raining and say, oh, I can't believe it's raining. My whole life is a thunderstorm. Nothing goes right for me. You know, I'm going back to bed. I wish I never woke up, right? Or a different perspective with the same condition is, wow, you know, it's raining today. Well, you know what? I'm going to take advantage of this and stay on the inside. I'm going to take another 45-minute nap before I get going. But I'm going to enjoy the day. I'm going to tackle some things that I haven't done on the inside. Again, the same situation is going on. It's still storming outside. But how you perceive what's going on in your own mind is what changes that whole outcome of the day. So,
Which is true, because if you think positive, you'll actually feel positive and have a positive. But a lot of people just like to complain and we're just brought up that way. I don't know why. It's just like, think of the worst, think of the worst.
right. You know, I tell people all the time, you know, I call it what ifing up. So we always what if down, right? You know, like, you know, well, what if my car breaks down? Well, what if, you know, this happens? Or what if I don't get well? Or, you know, and I understand that, because that's, you know, that's anxious thinking. But what if up? You know, we never go outside and say, you know, what if I find $50? You know, what if somebody gives me a gift card? You know, things like that. You know, what if I get an opportunity to be on a podcast, right? We don't do that. We what if down. And so we build a big negative muscle, right? And we're kind of lopsided in how we think, because we're never thinking, I always say optimistically. Like, you can look outside and see that it's raining. But being optimistic simply says, it's raining. I acknowledge that I don't like the rain, but also I'm going to acknowledge that there's something that I can do for myself, right? And I think that that's what the difference is. But we've grown up in a society where when people say, well, how you doing? Oh, I won't complain. Then they start complaining.
Right? I won't complain, but
Right.
you know what?
Right. And I always ask people, how are you thinking? Because that already tells me how they're feeling. But it takes time too. When you ask people, so how are you thinking today? They have to think about that. It's like,
am I thinking?
Yeah,
Like,
right.
what am I
Exactly. What
thinking?
am I thinking? Exactly. So I think that that gets to the heart of the matter as well. Is like people have to. Sometimes people don't hear they're complaining, because they've done it so
I was
much.
about to say they're so used to complaining. It's like if you're called out on it, it's like, oh, I didn't know I was doing that. I
Hmm.
just thought that was okay.
Hmm. And the message that we hear, NDRE said, the message that you hear, it comes from your lips first. So you hear it first, right? So if we're saying it because we're thinking it,
Mm-hmm.
then we're saying it out loud. We're just reinforcing that negative messaging to ourselves. And so it is okay that if you're not feeling well, or if you're not thinking well, it definitely is okay to say that. But it's difficult for me to believe that anyone has just a constant, everyday negative moment. Even people who are clinically depressed, which is chemical in nature,
Mm-hmm.
I think if they are taught to look at things from a perspective of saying, while this is going on, there's also something that is good going on. Maybe not perfect,
Mm-hmm.
but good going on. I think that that helps people as well. Just looking at something from a different perspective,
Yeah.
you know?
And I think that's hard because I am one of those people who are now, I'm trying to be more optimistic.
Gotcha.
I was, okay, what if I found $50? And I'm like, what if somebody's watching me to wait for me to pick up this $50?
You say I'm going to the
Yeah.
positive, the negative.
And I'm always going to the extreme. So
Mm-hmm.
the optimistic part,
Mm-hmm.
I definitely agree 100%. It allows you to shut down those negative thoughts. And I read Winning the War in Your Mind,
Mm-hmm.
and he talks about the mental ruts, how we build these ruts in our mind, in our brains, and it's like a lane. So if you want to build positive thoughts or if you want to build a new routine, you have to continuously do it so
Mm-hmm.
your mind can say, okay, it's time to do this.
Absolutely. We build dendrites, right,
Mm-hmm.
in our brains, right? And those are pathways. And those dendrites start from birth. They're being built from birth. And so when we learn, a lot of what we learn in what I see when I'm counseling individuals, a lot of it is learned behavior.
Mm-hmm.
We learn how to deal with conflict, adversity from the people who are in front of us, whether that's a mother, a father, a sister, a brother, an aunt, or uncle, whoever has raised you. That's where we learn certain behaviors from, and we learn to carry those on. So we hear, you're 0 to 16 and you're living with someone who always has an emotional outburst, is always angry about something, is always frustrated, is always mad. That's what we get relegated to, right? And so when I ask people, what's underneath the anger? And they're like, yeah, well, I'm angry. And I'm like, no, but, what's underneath that? I've been telling people, like, we have what I call the anger Afghan. And if anyone knows about what an Afghan is, my sisters, they crochet.
Okay.
And they crochet very heavy Afghans. And when you get under it, you cannot move. And that's what anger does to you. Anger can be paralyzing,
Yes.
right?
Oh my
And you
goodness.
can't move from that. And anger is a protective emotion. So if someone does something that causes you to feel a certain way and you don't want to feel that emotion, then you get angry and you protect yourself. But that's where it comes back to the fact that mental health it's active. It's something that you're always using, right?
Mm-hmm.
And our emotions are to be managed. Our emotions are to make us aware of what we're thinking and what we're feeling, and for us to be able to ask ourselves, okay, what do I need to do in this moment? Our emotions are not meant to be weaponized. They're not meant to make someone, you made me mad, so now no, I chose mad.
Yeah.
Right. I chose to be offended. Right. And are there people who try to cause individuals to think or feel a certain way? I'm sure. Yet at the same time, you have the opportunity to say, okay, well, I hear what you're saying. I don't agree with that. And I'm going to think about that differently. But those are also people who you may know, they just can't be in my world, right? So learning to manage those things and learning how to get up underneath that emotional Afghan, so to speak, that anger Afghan, to say, okay, so what's underneath that? What is underneath your anger? And when you ask it long enough, you begin to realize that people, they try not to say, I'm hurt. You're allowed to be hurt. That's an emotion. Or I'm sad, or I feel rejected, right? But people, they don't want to feel those uncomfortable feelings. So while anger can be very uncomfortable, it's also a means of where they can lash out. And so they feel that they get some type of relief from that, only to stay in that same cycle, but it gets internalized. So once I have the outlash, the outburst, I've not done anything to change where I've moved from emotionally. So now it just gets internalized. Oftentimes you see it as a result of stonewalling or shutting down. So.
And I'm just angry.
And I'm just angry.
Yes,
Yeah.
like
And you're just
I'm
walking
angry
around
forever.
mad.
Yeah. And then wonder why. Then you're mad at other people because you're angry.
Right. Right. And it's like what Cat Williams said one day, you mad at Ham? You wake up, you're mad at Ham. And it's like it's when you're in that cycle, after a while, that becomes very oppressive, right? You become oppressed because you're suppressing other emotions, the authentic emotions that you feel, such as sadness or rejection or hurt. And then I think that can lead to being depressed, right? And so I think a lot of this can be mitigated if we simply learn the host of emotions that exist. We are often relegated to just a few: mad, sad, angry, glad, happy, maybe jealous every once in a while. But there are so many other emotions. Like, an emotion is like, it's a beautiful day. That's an emotion. That's a feeling, right? Peace is an emotion, right? But just like, sadness is an emotion, or frustration is an emotion. And they're not the same things. Frustration and anger are not the same thing. But people often will say, I know that you're going to be mad. So people also relegate you to an emotion.
Yeah.
And I'm like, no, please don't tell me what I'm going to feel.
Let me feel it on my own.
Yeah, let me choose my emotion, But again, so we also have to be careful to not let people assign us an emotion. I know that you're going to be angry. How do you know? Now you're reading my mind and my emotions.
Now I'm angry because you told me that I'm going to be angry.
It's like kind of a setup, right? But I always say, like, tell me what you have to tell me, and I'll choose what emotion that I'm going to connect to that. Usually my default is not to be angry. It's really to be kind of pensive and try to think about, okay, wonder where that came from. So, yeah.
And that's when you say that we're taught different emotions. I was thinking about, as a kid, you draw the happy face, the sad face, the angry face, but there's not really more emotion. So I think that sticks with us as we grow up, and it's like, okay, I color my angry face red, so I'm angry.
Exactly.
But it's not like you can be happy. You don't have to, like, you can be angry, but you don't have to be angry.
Exactly.
And we identify, I feel like, with our emotions. We're like, or even if you're having a good day, at some point in your day, you're going to stop and feel that emotion that you're so used to feeling, because it's like, why am I not feeling this way? I'm not used to this.
Yeah, you start looking for it, right? And particularly like when you're doing work to get away from it. A lot of people who deal with anxiety, one of the things is when they stop feeling that constant anxiety, they're like, wait a minute, where's that anxiety at? So they kind of like try to conjure it up. Like, okay, is it still here? And I believe, like, anxiety, these are all normal emotions that we all have. The question is, what turns it up? And I ask that all the time. What turned it up? What triggered it? What made it stand out from the pack? Something happened to cause it to do that. And once people start identifying that, and then they can kind of turn back the dial and realize, like, okay, it's okay to have an anxious experience. I don't have to live in a state of anxiousness all the time. So sometimes what happens is those experiences, they get connected, or they become continuous, which means like, oh, now I'm always anxious. And it's really being able to separate what is happening right now is not going to be happening 10 minutes from now. And to allow yourself to live in the moment versus living 10 days from now,
Yeah.
10 minutes from now. So, yeah.
Okay. Good.
Yeah.
Good. Okay. Let's see.
I know we probably got off a
I
subject, huh?
know it's okay. It's okay. Okay. So, how do you personally help reduce stigma, whether in sessions or outside your practice?
Great question. So, again, I think I know that I was called to this. I know that I was purposed to do this. And so in session, you know, I rarely tell people what the diagnosis is because I don't think in the bigger scheme of things that it's important. But when people do ask me, I ask them, you know, what would change if you knew what the diagnosis is? Now, what I'm saying by that is most people will tell you when they come in, I feel anxious.
Mm-hmm.
That's usually the diagnosis. I feel depressed. That's usually the diagnosis. But there are, you know, the DSM-5 is this thick, right? So there's a lot of diagnoses. And again, most times a lot of people specialize, right? So my specialty is anxiety and depression, communication between couples, because a lot of times lack of communication creates anxiety as well. And so in therapy, in my practice, it's just talking, you know, it's talking about mental health and wellness, not mental illness. And I do definitely want to get to differentiate that. But it's interesting because when I'm out, like outside of the office, and I might be, you know, in a grocery store, and this does happen to me a lot, but people will turn around and just start talking to me. And they'll start telling me like some really deep stuff. And I'll say, you know, have you ever thought about seeing a therapist? And they're like, no, I would never see a therapist.
Like, see you later, bye.
Yeah. And I'm like, well, you know, technically you're speaking to one right now. And they're like, really? And I'm like, yeah, you know, I'm a therapist. You know, that's my trade. That's my profession. And so what I really do try to do is let people know, like, therapists aren't these like spooky individuals. Like a lot of times I don't want to know people's business, right? Because I do it all day. And so, you know, my daughter always says, Mom, you have like therapists just stamped on your head, but people will just start talking to me. And I'm not going to say like, okay, I don't want to talk to you right now, because you never know what's going on with people. And sometimes that brief conversation in a grocery line, a checkout line can, you know, help somebody to not take their life or help somebody see a different perspective. So I never do not talk to people, but I do ask people, like, have you ever considered seeing a therapist? Right. Because I think that when they hear it from someone who is a stranger, it's not an insult. And I tell them, that's not to insult you, but that's to say that there are people that you can talk to that will listen to you, you know? So that's how I do it.
Okay.
Yeah.
And I could see people walking up to you and just talking. I have two friends like that. Everyone, no matter where we're at, someone is pouring their heart out to them. And it's just like, since you said that, it's like there are people who are called to heal people in this sense.
Absolutely.
But educating them, and that's how you just gravitate towards the people. They don't do that to everyone. There are some people who just want to talk.
Absolutely, absolutely. But it happens in clothing stores. It happens in grocery stores. It happens when, you know, we're on vacation. You know, people will just be standing somewhere, and people will just turn around and say, "Hi, how are you?" And they'll say, "Oh, you know, I'm okay." And then they start having this conversation. My kids are like, Mom,
Right.
you know,
Like we're on vacation.
and, you know, and my husband will say, okay, well, what did you tell them? Like, did you tell them? No, I didn't tell them anything. Like, I don't wear any of my merch, you know, like, except it is tattooed, but, you know, people would have to ask. But it's just, I think that maybe people just know. And again, I am thankful for the gift. I am thankful for being chosen to assist people on their mental health journey. And anyone who comes and sits in my chair, I do tell them thank you, because to come and sit down, and I've been on both sides. So I tell people that all the time. I've been in the chair as the client, but I'm also on the other side as the therapist. And I know what that's like to sit down with a total stranger and begin to share things, you know, so.
And to share things nine times out of 10 blocked out from yourself. It's like,
Absolutely.
I don't want to talk about this. Leave me alone, please. No.
Absolutely. Absolutely. It's tough. It's tough. I tell people therapy is not for the weak. You have to be right. Because if it was easy, every therapist who is a therapist would have thousands of people knocking, hey, I want to come and talk. Self-disclosure and like looking at yourself and putting the pieces together from your past to now so you can have a better future, a better presence and a better future. That's work. And if there's been a lot of pain in your past, a lot of trauma, a lot of history, or whatever it may be, some people would rather it lay dormant and lay there. But what they don't realize is that a lot of that stuff shows up in your living. Until you deal with it, until you face it, it shows up in your living. So,
Which is so true, because testimony here. What would you say to someone listening right now who's struggling but still hesitant to try therapy because of stigma or fear of being judged?
what I would say to them is if they're considering seeing a therapist, start with your insurance. If you are employed, start with your EAP. One, it's free. The EAP pays for at least 6 to 8 sessions sometimes. So that's an opportunity to at least have the experience to try to get comfortable to know what this is about. The other thing is that a lot of therapists, including myself, offer like a 15-minute consultation. And so usually what you hear on the telephone is what you're going to get in therapy for 50 minutes, right? And it's just really a back and forth conversation with the therapist asking questions to evoke thought, right? To evoke a deeper thought and to also evoke reflection. But I would say to them, don't be afraid, because therapy is not going to make you say anything that you don't want to say. It's not going to make you do anything that you don't want to do. And I'm talking about extreme stuff. Therapy is designed, though, for you to do the work, for you to have to look at yourself. And sometimes people reach a place where they're comfortable, and then it's like, uh-oh, I'm not comfortable. And I get that. There are some times where people get so far and they're like, okay, I'm not ready for that next step. And that's part of, as a therapist, knowing that people dive in. You're not going to dive into the deep end, particularly if you can't swim, right? You're going to start out in the shallow water, and you might get real comfortable there for a while. And then when it's time to go deeper, it's like, I'm not ready. They're standing on their tippy toe. I'm not ready. And so sometimes they'll stop. That's okay. I don't get upset where, people don't come anymore, because sometimes people have realized like, oh, I got the tools to do this. That's what I love to see. I tell people my job is to work myself out of your life, not to stay in your life, and so I would suggest that they ask other people, have you ever seen a therapist before? Because we ask people stuff like, have you ever gone to the gym before? Right?
Have you been to that club? Have you ate here?
Yeah. Have you ever seen a personal trainer? We ask people those types of things. But when it comes to our mind, we don't ask people those things. And we should, because people who've been to a therapist and they've been to an effective therapist, they're going to share that. Oh, yeah.
That's me. I am therapy queen to anybody. Therapy and journaling. I'm like, do it, please, please, please. I know people be like, she's so happy she went to therapy.
Yeah, because a therapy can change your life. And what it is like, it's you changing your life. It is the person who's doing the therapy is changing their own life by doing the work. I tell people, when people say, oh, thank you so much, I tell you, you're doing the work. I'm just simply reflecting the work that you're doing. And when it gets hard, I give a therapeutic push, not to push people off a cliff or anything, but to say, it's time to go a little bit deeper. If you want the change that you said that you want when I first asked, then it's time to go a little bit deeper. So.
And when you go deep, I feel like we're all like, this is who I am. I've been this way for the X amount of years. This is who I am. But when you heal and go to therapy and learn, you're like, wait, this isn't who I am.
It's who I became because I tried to mask what I was experiencing. I tried not to feel what I was experiencing. But when you finally get to that place where I'm going to get acceptance with everything that happened to me. And I tell people acceptance doesn't mean what happened to you was right. It means what happened to you happened to you, but it doesn't define who you are. When you look at yourself, and I ask people, what did you learn about yourself in that process, right? I ask that because people often will talk about what they learned about that other person. They're this and they're that. Okay. But what did you learn about yourself? Because if at the end of the day, you've gotten through that space. It may have been hard, but what you learned is I can get through it. Like I'm okay. So yeah, is it going to hurt? Yep. Is it going to be uncomfortable? Absolutely. Will you be sad at times and cry? For sure. But will you be okay? Yes. Yes. Because being okay, I do believe is a choice. Yeah, I believe that it is a choice.
Yes. Boo-hoo cry. It's like, no. Okay, last question.
Okay.
What questions should someone ask when searching for a therapist? Because I get a lot of people, when I say therapy to them, they're like, I've been to a therapist, I don't like them, and then they just shut down. So I feel like knowing so you go to a therapist and you don't think to ask questions, but I feel like it's an interview. If I'm about to tell you my whole life, I need to know you're down for me. And so what questions can someone ask?
So there are a lot of questions, right? One, when you're looking for a therapist, you have to know what your personality is, and you have to know what that other person's personality is like too. So ask questions, one, starting with, what are they like as therapists? There are people, and when you're trained as a therapist, you learn things like minimal prompts. Okay. Yes. Some people in some cultures aren't comfortable with that style because they want to be guided more, right? And so it's learning how to have that conversation. Some people want to know, like, what's their office like? Ask them about like what their fees are. Do they take insurance? Do they take private pay, which simply means out of pocket? Do they give a sliding fee scale? We all have to carry malpractice insurance, but some people who are in private practice don't use panels, which are through insurance companies. And so if they don't use panels, while you should carry malpractice insurance, some people don't.
Okay.
I'm not saying that they all don't, but some people don't because it's an added cost. But, do they have malpractice insurance? What's their reputation, right? So if people know that they've gone to a organization and they've heard their information repeated on the street, you know what the reputation is like, right? So you want to know what the reputation is like of that individual. People will tell me, like, I don't see you out a lot, or I don't hear your name a lot. And honestly, I don't go out a lot. Like that's just who I am as a person. But when I got into this, my decision of how I was going to advertise was very intentional, because I do think that as a therapist, we carry a lot of information, and we carry a lot of people's information, right? That is very personal to them. And so I think that it's important that there is, like, we have a confidentiality clause, but do they really practice confidentiality, right?
Exactly.
It's those types of things that I think that people should ask. Did you have a good experience with this therapist? Why do you like this therapist? What don't you like about the therapist, right? Because some things that you like, another person may not like, and vice versa. So I think just asking those questions, but finding a therapist is like finding a good doctor. You have to maybe try a few before you find one that fits with you. And it's also like finding the right medication. There are thousands of medications for different types of disease states, but I can't give you what I take because it might not work with your body chemistry. So I think it is not being afraid of asking a lot of questions. And I always give people an opportunity when I'm first meeting them to ask whatever questions they have, but also after each session, what was useful to you today? What did you learn today? What was helpful? Sometimes people say, I hate when you ask those questions, but I ask because it also, I'm not looking, I'm not fishing for compliments, but I'm looking to understand what was useful. And I also ask what wasn't useful, right? Because if I'm doing something that a client doesn't like, and I'm saying like outside of, if something is therapeutic and a client might say, well, I don't like digging into, my thoughts or my feelings. Well, that's what therapy is.
Yeah.
But if it's something like talking or using a scenario, and if they don't like that, okay, well, I won't use a scenario. Like it's because these are the client sessions, so I let them lead how they want the sessions to go.
Okay.
Yeah.
Thank you.
Absolutely.
Thank you. This was really, really, really beautiful.
Thank you.
And
It
I
was.
held my tears in.
Did you?
Yeah, I did.
Did you think you were going to cry?
I did, because
Why?
it's such a sensitive topic, and it really, really, I love it. I just feel like everyone needs to tap into their mental health.
Absolutely. And I want to make one more point,
Okay.
Amber, before we get off. And that is that mental health and mental illness are two different things. Everyone has mental health, even individuals who are dealing with a mental illness. But mental illness causes individuals, it can impact a person's mental health, but they're not the same thing. Mental health is a specific disease. Mental illness, is a specific disease state. So it is when people are diagnosed like with major depressive disorder, bipolar disorder, anxiety disorder. But again, these are also continuums, and we can all find ourselves in the DSM-5 if we look hard enough, right? So I don't want people to think like, oh, I've been diagnosed with this, now I'm mentally ill. The thing is that like everything else, things are on a continuum. There's diabetes, but there are people who have an A1C of 7. There are people who have an A1C of 13. That's a different level of diabetes, right? And so I just want people to understand that when you come into therapy, you're not necessarily being diagnosed with a mental illness, because that changes how you cope. Usually people who are mentally ill and it's untaken care of are not coping well. So there's just a difference in that. And I think it's just important for people to hear that mental health and mental illness are not the same thing, although mental illness does affect your mental health. Yes.
Thank you for sharing that.
Absolutely.
That was a good. I know you was like, I have to let you know that.
Yeah.
Well, that's helpful, because
Yeah.
a lot of people don't know how to decipher the two.
They don't, and so they think go to a therapist. You think I'm mentally ill. No, I don't. I think you need to talk to somebody. So. Yeah.
Well, thank you again. I'm Amber with Fancy Athletics, and this is Eletta.
Hi, bye. It's
Right?
been real.
Thank you. All right.
Thank you.
And we out.